Order. Question number 2, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What is the total amount in efficiencies that district health boards have made in 2015-16?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, the figure for 2015-16 has not yet been finalised, but we've set a very clear expectation that there will be around 1% in savings as in every other year. That's not unlike the automatic efficiency dividend that was required of district health boards before 2008.
Supplementary question, Mr
Supplementary question, the Honourable Annette King.
Is it acceptable to him for DHBs to make the efficiencies he's demanded by requiring doctors to work up to 12 days without a break and with 7 back-to-back night shifts because DHBs can't afford additional staff?
The Honourable Dr Jonathan Coleman.
Well, as the member will know, there's ongoing discussions between DHBs and the doctors' unions about their working conditions, and this is nothing new. It's been going on for years and years, but overall doctors' conditions have improved over the years. I can tell you that from personal experience.
So that he's obviously okay. Supplementary question, Mr Speaker.
Order. Supplementary question, the Honourable Annette King.
What is his reaction to overworked doctors reporting 1,162 adverse effects on patients because they were tired, and 275 admitting that they'd fallen asleep at the wheel on the way home because DHBs can't afford to ensure safe staffing levels?
The Honourable Dr Jonathan Coleman.
Forming part of the negotiation strategy, and as I said, DHBs and the doctors' unions are currently in discussions around these very matters.
Supplementary question.
Supplementary question, the Honourable Annette King.
Does he disregard nurses when they said just a week ago that staffing levels and working hours do not meet the best and safest standard of care that patients should expect?
The Honourable Dr Jonathan Coleman.
I meet and speak with nurses regularly, and they were very happy with the negotiations and the settlement that they achieved last year, which was enabled through very constructive discussion on both sides.
Supplementary question, Mr Speaker.
Supplementary question, Honourable Annette
Does
King.
he think that Capital and Coast DHB, which has been required to make $148 million in efficiency since 2011-12, could have made better use of that money on primary mental health services, which they are now cutting to meet his demands?
The Honourable Dr Jonathan
Well,
Coleman.
I'd have to check the facts around that, but look, they're providing an excellent service for people in the Capital and Coast catchment area. Obviously, there's some financial pressure there, but the good news is that the $60 million deficit that they did have under Labor has now been reduced to 10, and we expect that to continue to come down. At the same time, there's more operations, there's more appointments, more doctors and nurses servicing that DHB.
Order. 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 Question.